Hi and happy day to all. Welcome to my channel. Welcome to see the last topic of drugs acting on hemopoietic system blood plasma volume expanders. Major blood loss entails the danger of life-threatening circulatory failure, that is, hypovolemic shock. The immediate threat results not so much from the loss of erythrocytes, that is, oxygen carriers, as from the reduction in volume of circulating blood. To eliminate the threat of shock, replenishment of the circulation is essential. With moderate loss of blood, administration of a plasma volume expander may be sufficient. Blood plasma volume expanders, also known as plasma substitutes or blood volume expanders, are intravenous fluids used to increase the volume of blood plasma. They are typically administered in situations where a patient has lost a significant amount of blood or is at risk of hypovolemia, a condition where there is a decreased volume of circulating blood in the body. There are two main types of plasma volume expanders: 1. Crystalloids and 2. Colloids, crystalloids. Crystalloids are aqueous solutions of mineral salts or other water-soluble molecules. They are the most commonly used plasma expanders because they are inexpensive and readily available. Common examples include 1 normal saline 0.9% NaCl used for fluid replacement in cases of dehydration, shock, and blood loss. 2 ringers lactate. Lactated ringers contain sodium, potassium, calcium, chloride, and lactate. It is often used in cases of trauma, surgery, and burns. 3 dextrose solutions. Dextrose in water, example D5W, which is 5% dextrose in water, provides both fluid and calories. Blood plasma consists basically of water, electrolytes, and plasma proteins. However, a plasma substitute need not contain plasma proteins. These can be suitably replaced with macromolecules, colloids that, like plasma proteins, 1. do not readily leave the circulation and are poorly filtrable in the renal glomerulus, and 2. bind water, along with its solutes due to their colloid osmotic properties. In this manner, they will maintain circulatory filling pressure for many hours. On the other hand, volume substitution is only transiently needed, and therefore complete elimination of these colloids from the body is clearly desirable. Compared with whole blood or plasma, plasma substitutes offer several advantages. They can be produced more easily and at lower cost, have a longer shelf life, and are free of pathogens such as hepatitis B or C or AIDS viruses. Colloids contain larger molecules that stay in the vascular system longer than crystalloids. They are used to maintain plasma oncotic pressure and are more effective at expanding plasma volume with smaller volumes of fluid. Common examples include 1. Albumin, a natural protein solution derived from human plasma. It is used in cases of severe blood loss, burns, and hypoalbuminemia. 2. Dextrans, synthetic polysaccharides that act as plasma expanders. They are used for volume expansion and to improve microcirculation. 3. Hydroxyethyl starch has a synthetic colloid used for volume expansion in surgery and trauma. There have been concerns about its safety in certain patient populations. 4. Gelatines derived from bovine collagen and used for volume replacement in acute blood loss situations. Dextran is a glucose polymer formed by bacteria and linked by a 1:6 instead of the typical 1:4 bond. The chain length of single molecules, however, varies widely. Smaller dextran molecules can be filtered at the glomerulus and slowly excreted in urine. The larger ones are eventually taken up and degraded by cells of the reticuloendothelial system. Apart from restoring blood volume, dextran solutions are used for hemodilution in the management of blood flow disorders. As for microcirculatory improvement, it is occasionally emphasized that low molecular weight dextran, unlike dextran 70, may directly reduce the aggregability of erythrocytes by altering their surface properties. The most important adverse effect results from the antigenicity of dextrans, which may lead to an anaphylactic reaction. Hydroxyethyl starch hetastarch is produced from starch. By virtue of its hydroxyethyl groups, it is metabolized more slowly and retained significantly longer in blood than would be the case with infused starch. Hydroxyethyl starch resembles dextrans in terms of its pharmacological properties and therapeutic applications. Gelatine colloids consist of cross-linked peptide chains obtained from collagen. They are employed for blood replacement, but not for hemodilution in circulatory disturbances. Indications for use: plasma volume expanders are used in a variety of medical situations, including trauma with significant blood loss, surgical procedures with expected blood loss, burn patients with significant fluid loss, severe dehydration, septic shock and other forms of shock, hypovolemic shock. Risks and considerations: while plasma volume expanders are critical in managing fluid loss, they also come with risks and potential complications such as allergic reactions, especially with synthetic colloids, alterations in blood clotting mechanisms, risk of kidney injury with certain colloids like hydroxyethyl starch, fluid overload, leading to oedema and heart failure. The choice between crystalloids and colloids depends on the specific clinical situation, the patient's overall condition, and the potential risks and benefits of each type of fluid. Thank you for watching.